I'm very interested in kind of, I like to talk about motivation in sort of three different categories. On the one hand, I think the work of Prochaska and colleagues, provides an amazing motivational framework. It's a very sort of cognitive one, and it looks at people like where their thinking is, in terms of making a behavior change. I mean, so much, and this isn't just about pain, diabetes, hypertension, GERD. I mean, you name it. There's a lot of lifestyle-related disease out there where important, lifestyle changes need to be made. And Prochaska's system is, kind of a system that helps clinicians learn how to assess where a person is in terms of their interest and willingness in making a behavior change. And then it has sort of specific ways of talking to people at that level. So, there's, of course, the pre-contemplative level, where the person's not even thinking about making a behavior change. So, obviously there, the clinician's going to say, let's get the ball rolling and starting to think about it and so on. What are the benefits of considering it and all that? And I like it, and it's, it's been shown to be remarkably helpful in smoking cessation and in addictions and in a whole range of areas. And I think it's very, very important. But for some people, in my mind, that approach is almost like a little too cognitive. And so I had a professor in graduate school who was a huge devotee of William James, and he really impressed me, helped me to learn about William James's work. And in 1895, William James wrote The Principles of Psychology, two 3,500-page volumes, and the guy was way ahead of his time. He was really a genius, and he wrote a lot about habit formation and about self-view. And a lot of us think that I do the things that I do because I'm this or that kind of a person. James actually said the opposite. He said you've come to view yourself a certain way based on what your lifestyle habits are. So your self-image emerges from your behavior, not the other way around.